Good morning to everyone. My name is Sarchana Devi from ECE department. My roll number is 234G180411. Subject name is Environmental Science. Subject code is 23NC01. Today I will explain about causes and effects of the HIV/AIDS and review of the impact of the HIV/AIDS. Introduction to HIV/AIDS. HIV means human immunodeficiency virus. Attacks the immune system, specifically the CD4 cells. AIDS means acquired immunodeficiency syndrome is the final stage of HIV infection. Understanding the causes and effects of HIV/AIDS is crucial for effective prevention and treatment. What is HIV? HIV is a virus that can lead to the disease AIDS. AIDS is left untreated. It is primarily transmitted through unprotected sexual contact, sharing of needles and from mother to child. Early diagnosis and antiretroviral therapy can manage the virus and prolong life. What is meant by AIDS? AIDS is characterized by a severely weakened immune system. Individuals with AIDS are at increased risk for opportunistic infections and certain cancers. Without treatment, HIV can progress to AIDS in approximately 10 years. Causes of HIV transmission. Unprotected sexual intercourse is the leading cause of HIV transmission globally. Sharing needles and syringes among drug users significantly increases the risk of the infection. Mother-to-child transmission during childbirth or breastfeeding can also occur without intervention. Chain of infectious agents, bacteria, fungus, virus, prion, protozoa. Reservoir, people, objects, water, soil, food, animals. Portal of exist, blood, body, fluid, tissue, stool. Mode of transmission, ingestion, contact, droplet, transfusion, transplant. Portal of entry, muscutaneous, transplacental, susceptible odds, people, animals. Risk factors of HIV infection. Certain populations, such as men who have sex with men, are at a higher risk of HIV infection. Individuals with multiple sexual partners or inconsistent condom use are more vulnerable. Socioeconomic factors, including poverty and lack of access to healthcare, can contribute to higher infection rates. Risk factors, newborns or nursing infants whose mothers tested positive for HIV but did not receive treatment also are at high risk. Most dangerous sexual practices are not intercourse. Recent evidence that HIV can be transmitted by oral sex. Heterosexual transmission is easier from men to women than women to men. Risk of acquiring for men is greater if contact during the global statistics of HIV/AIDS. Approximately 38 million people were living with HIV globally as of 2021. In 2020, around 1.5 million people were newly infected with HIV. The African region remains the most affected, accounting for nearly two-thirds of all cases. Effects of HIV on health. HIV leads to a gradual decline in immune function, making individuals more susceptible to infections. Common opportunistic infections associated with AIDS include tuberculosis and pneumonia. Mental health issues such as anxiety and depression are prevalent among those living HIV/AIDS. Social effects of HIV/AIDS. Stigmatization and discrimination against those living with HIV can lead to social isolation. Families may experience emotional and financial strain due to members' illness. Communities may face increased healthcare costs and loss of productivity due to the epidemic. Economic impact of HIV/AIDS. HIV/AIDS can hinder economic growth by affecting the workforce and productivity levels. Healthcare costs for treatment and care for affected individuals can burden economies. Loss of skilled labor due to illness or death can affect various sectors, including education and healthcare. Prevention stages. Comprehensive sex education and awareness campaigns can reduce the spread of HIV. The use of condoms and pre-exposure is effective in preventing transmission. Needle exchange programs and safe injection practices can help reduce infection rates among drug users. Treatment options. ART therapy is the primary treatment for HIV, helping manage and diagnose. ART can reduce the viral load to undetectable levels, improving health and preventing transmission. Regular medical checkups and adherence to treatment are essential for effective management. Importance of testing. Regular testing for HIV is crucial for early detection and treatment. Many individuals are unaware of their HIV status, embracing the need for routine screenings. Increased awareness of testing can lead to a reduction in new infections and better health outcomes. Challenges in HIV/AIDS response. Stigma and discrimination continue to hinder effective prevention and treatment efforts. Limited access to health care in rural and low-income areas presents significant challenges. Misinformation about HIV/AIDS can perpetuate fear and hinder public health initiatives. Future directions in HIV/AIDS management. Continued research to vaccines and long-acting treatments is essential for future progress. Strengthening healthcare systems and public health initiatives will improve access to care. Global collaboration and funding are crucial in the fight against the HIV/AIDS epidemic. Conclusion. Addressing the causes and effects of HIV/AIDS requires a multifaceted approach. Ongoing education, treatment, and support are vital for individuals and communities affected by HIV/AIDS. Together, we can work towards a future with reduced stigma and improved health outcomes for those living the HIV/AIDS. Thank you to all.